Hello and welcome to my channel. This video is going to be about osteoporosis. Here we have Mrs. Jane Doe. She learned that in 2010, among people over the age of 50, 15% of women and 4.4% of men had osteoporosis. She's interested in learning more about skeletal health. 3 things matter for strong bones: their size, shape, and density.
Definitely.
I want to elaborate more on the shape. Look at the internal structure of this bridge.
Nice bridge.
The rods are important for distributing weight without making the bridge too heavy.
Gotcha.
The inside of bones are structured similarly in order to be light and strong. By the way, this internal organization of bone is called trabeculated bone. Now then, Mrs. Doe asked about osteoporosis. Osteoporosis is when the size, shape, and density of the bone become affected in a way that make the bone weaker. For example, notice the internal breakdown in the osteoporosis bone. This is where the name pore in osteoporosis comes from the enlarged pores within the bone. In order to help Mrs. Doe, we need to collect the right information. Here is a questionnaire that will help us determine her risk for osteoporosis. Let's go through them.
Alright, let's.
We have age, sex, weight, height, previous fracture, parent fractured hip. This is because osteoporosis has a genetic component. Current smoking, glucocorticoids, also referred to as steroids, rheumatoid arthritis, secondary osteoporosis, alcohol 3 or more units per day, and femoral neck bone mineral density.
Oh, what was that last one?
This questionnaire is called the Fracture Risk Assessment Tool, or FRAX for short. You can find it by searching on Google.
Oh, nice.
Now then, let's talk more about this part. Femoral neck bone mineral density.
Oh, what's that?
This is obtained from doing what's called a DEXA scan. A DEXA scan is an X-ray of the hip and spine. It compares your bone density to that of Caucasian women ages 20 to 29. The reason is because elderly Caucasian women are at greatest risk for developing osteoporosis. Therefore, most research studies have collected information from them. So, there's simply not enough data for men and women of other ethnicities. However, it still gets the job done.
Well, that's good.
The DEXA scan gives us a standard deviation for the hip and the spine. If either standard deviation is between negative 2.5 and negative 1, then you have what's called osteopenia, a milder version of osteoporosis. If either are less than negative 2.5, then you have osteoporosis. Okay, looks like Mrs. Doe is done with her questionnaire.
Good for her.
Taking a look at this, she marked yes for rheumatoid arthritis and for consuming 3 or more units of alcohol a day. And looking at her BMD, since her standard deviation is between negative 2.5 and negative 1, she has osteopenia. Let's cover this part now. This gives us her chances of having a fracture in the next 10 years. If a person's chances are greater than the following: 20% for a major osteoporotic fracture, 3% for a hip fracture, then it is usually advised for the patient to start medication. Understandably, Mrs. Doe is wondering how her bones could have become weak. The reasons are mostly covered by the FRAX questionnaire, but let's write a list of possible causes. First, a large part of bone is calcium. For this reason, it is important to consume enough calcium, but how much is enough? At least 1,200 milligrams a day, or 4 cups of milk. You can learn more about calcium in my video covering hypocalcemia. Alright, we have our first one. However, eating the calcium and then having it go right through us doesn't do the body any good. That's where vitamin D comes into play. Part of vitamin D's role in the body is bringing calcium out of the intestines and into the blood vessels. Now, how much vitamin D do we need? At least 800 international units a day. Alright, calcium and vitamin D. Now, this part is sad. The most bone we'll ever have is around the age of 30. It's all downhill from there. Bone loses 0.5 to 5% of its mass every year. One goal with treatment is to keep the number as close to the lower end as possible. Now we have 3. Estrogen. I think estrogen and menopause are what comes to most people's minds when it comes to osteoporosis. In order to understand estrogen's role, we need to bring up 2 important cells. One is the osteoblasts, which build bone, and the osteoclasts, which cleave bone. Estrogen increases the effect of osteoblasts and decreases the effect of osteoclasts. After menopause comes into play, the ovaries stop making estrogen. And as a result, there is less osteoblast activity and more osteoclast activity, and therefore weaker bone. Menopause is not the only cause of decreased estrogen. Anorexia or a low BMI can cause it. So can smoking and glucocorticoids, also referred to as steroids. Testosterone also promotes bone growth. Unlike the ovaries, the testicles continue to make testosterone throughout a man's life. But if for any reason a man's testosterone drops too low, specifically 200 nanograms per deciliter, then he will be at increased risk for osteoporosis. Now we're looking at 4 possible causes. 3 more to go. Now then, there are 2 hormones that increase the activity of osteoclasts and therefore weaken the bone. One of them is thyroid hormone. The other is parathyroid hormone. I think we should change number 4 to just hormones in general. And then we can add thyroid and parathyroid hormones along with the sex hormones. Number 5, glucocorticoids or steroids. These will weaken bone when taken for prolonged periods of time. And in those scenarios, osteoblast activity is decreased and osteoclast activity is increased. We're almost done. Avoiding exercise is our next one. The best exercises for strengthening bones are ones that utilize gravity, like walking, jogging, and weightlifting. Exercises like swimming and biking, while great for burning fat, take the weight off the bones. Therefore, they don't strengthen them as well. Alright, last one, best one for last. The classics, alcohol and tobacco. Patients who drink more than the following a day, 24 ounces of beer, 10 ounces of wine, and 2 shots of liquor, are at an increased risk for osteoporosis. Alright, we've covered just about everything for Mrs. Doe. After all this, we've got to ask ourselves, what's the big deal with osteoporosis? Sadly, with osteoporosis, a person's risk of breaking a bone is high. For women, it's 33%. For men, it's 20%. The most common bone fracture is in the vertebrae, a bone in the spine. However, the deadlier bone fracture is the hip, and it is a very serious problem. When it comes to a broken hip, 20% of women die within 1 year, compared to 50% of men. Patients who survive past the first 2 years will still have a 3 times increased risk of death. With a broken hip, most patients become disabled, and this can mean they can no longer work. The sudden, severe decrease in quality of life has often led to depression. So unfortunately, there aren't any symptoms with osteoporosis. This is why doctors emphasize regular screening. In addition to the DEXA scan, your doctor will collect blood tests. For reasons explained earlier in the video, they'll want to measure your calcium, vitamin D, steroids including cortisol, the body's stress hormone, estrogen, testosterone, thyroid, and parathyroid hormones. On top of that, your doctor will order tests like a complete blood count and complete metabolic panel to verify there aren't other diseases that could be affecting your bones on top of osteoporosis. I will be discussing treatments in a separate video. Before I finish, I want to touch on two things. One, growing up, I was taught that soft drinks weaken bones. Today, there's debate if the connection between soft drinks and weakened bones is a coincidence. The idea being that soft drink consumers are less likely to exercise and eat enough calcium. Next, people mistakenly believe that people fracture their hips while doing some exertional activity. However, 90% of hip fractures happen from falling at a standing height. Usually, patients say they suddenly lost their balance or tripped while walking around their house. Please comment below on how you liked this video and mention any medical topics you are interested in learning more about. As always, thank you for watching.